to pause for a few seconds to allow more people to join. And I must say this goes against the grain. I'm a firm believer in, if we've set a time and a lot of people have made the effort to be on time, then it's not fair to those people to cause a delay and make them wait for the proportion of people that join late. But let me strike a compromise and ramble on for a few seconds while we wait for more people to join. I should mention that I think if you look at the screen, the number of participants, they're steadily ticking up, and we're currently on 68. That's misleading, and I'll explain in a couple of minutes how the conference is broken into two clusters. So you're only seeing the 70 participants that have linked up so far from the panelist cluster of people. There's a much bigger chunk of people that are linking in webinar mode that you don't actually see reflected over there. So it's at least double that number of participants that are listening in right now. So Tin, I think I've given due heed to the request to wait a few seconds. Let me therefore express a sincere welcome, warm welcome to all of you for setting aside time to join us in our Asia Pacific Malaria Elimination Network Vector Control Working Group Conference. Genuine pleasure to have some excellent speakers lined up that are going to tell us about, keep us updated, state-of-the-art, current status on a number of different topics and so on. So we look forward to having that shared knowledge from those people. Let me introduce myself. My name is Leo Braak. I have the privilege of being the technical lead for the Vector Control Working Group, the APMEN Vector Control Working Group. Also to mention that there's an excellent team running in the background to ensure that the technical aspects are, all the ducks are in a row and functioning properly. That team is led by Dr. Tin Chor Su, who's our Vector Control Working Group program coordinator. There's also Dr. Pon Si Hein, who's the APMEN program manager. And also there's Shobicha Wulandari, also known as Wulan. She's a recent appointee and recent master's graduate as technical officer to help us. And then Sam Uanual, a very capable admin assistant. Welcome to everyone. I see some very familiar names. Great to have you on board. I just want to mention a couple of things. First of all, this session is being recorded and it will be uploaded subsequently onto our OREN website, the Online Resource Exchange Network for Entomologists, www.orene.org. We're also on that website. There's the daily agenda. We've got 4 afternoons over the next 2 weeks that will be devoted to this conference, and the daily agenda is listed on that site. Just go to conferences. It's at the top of the screen on the left hand side. If you click on there, the drop down list will show the conference and you can find it there. So there's also, I need to explain that there are 2 components. The participants to this conference are clustered in 2 for technical reasons, technical and practical reasons. We have a panelist mode where, and those are the speakers and country partners, the NMCP representatives, etc., that we've put into panelist mode where they're able to have audio and visual access. And then there's 100 slots available for those, representatives. Unfortunately, for technical reasons, we can't accommodate everyone on that live audio and visual capacity. So we've had to put the rest in webinar mode where you're automatically muted and your video is off. I encourage everyone, if you're not speaking, that means those in the panelist mode, please turn your audio and visual off. But for everybody, it doesn't matter which cluster you're in, please feel free to join via the chat box, question and answers. Pose, use the chat box and send your messages. Amongst those people that are running in the background, they'll pick up those messages and feed it through to be addressed. So I think that's about all I was supposed to deal with. So I'm going to now hand over to Amita Chebi, our Senior Director for the Asia Pacific Malaria Elimination Network, and ask Amita if she can do the official opening and welcome. Please, Amita.
Thank you, Leo. Good morning, good afternoon, everybody. I'm delighted to welcome you to the APMEN Vector Control Working Group's annual conference. The annual meeting of our APMEN working groups are always much anticipated events on the calendar of the malaria community here in Asia Pacific and beyond. And this year, while we bring the annual conference to you in a virtual format, Leo and his team have worked very hard to make sure that we provide an experience that's as similar to an in-person meeting as possible. So they look forward to many interactive discussions. We have a Q&A box. There'll be lots of opportunities for exchanging information. So really hoping to make this as engaging and interactive as possible. The pandemic is still raging as we speak in many parts of Asia. And while the devastation has been immense, I'm hoping that this really compels us as a global health community to think more deeply about accelerated action on those areas that we've spoken about for so long, but which will really provide some solutions, I think, to the current crisis as well as to future pandemics. So this is really around the focus on health system strengthening, the need for real-time accurate data through robust surveillance systems, the need for more integrated ways of working between disease areas, the role of the private sector. I think you'll find that several of these themes are reflected in the agenda over the next 4 days of the VCWG annual conference. An important area of focus for us at the Secretariat this year has been to ensure greater alignment and coordination between our working groups. As you know, there are important points of intersection between the technical areas of vector control, VIVAX, and surveillance. And we hope to be able to uncover efficiencies and synergies across these technical areas to really strengthen the hands of our national malaria control programs working on these areas. So again, I think a lot of these themes are reflected in the agenda, but I strongly encourage all of you to bring your perspectives beyond vector control to these important discussions that will take place in the next few days. We've seen an incredible amount of coordination and cooperation across the global health community as everyone has come together to fight the virus. And these themes of coordination, collaboration, and cooperation are central to the work that we do at APMEN. So we went through a process to strengthen the governance framework for APMEN last year and to ensure that the network is even better placed to support the needs of our country partners in this last 10-year leg towards elimination. So as part of this process, we now have new chairs and co-chairs for each of the working groups. Each of the APMEN working groups is chaired by a senior leader from the National Malaria Program in the region. And these chairs really play a critical role in setting the agenda and direction for the working groups. It is with great pleasure that I want to introduce Dr. Rose Nani, the chair of the APMEN Vector Control Working Group. Dr. Rose is the Deputy Director of Communicable Diseases at the Disease Control Division, Ministry of Health, Government of Malaysia. She has more than 20 years experience as program manager and managing infectious diseases and vector-borne diseases at the state, national, and international levels. She's been closely associated with APMEN since the early days and is a passionate advocate for South-South collaboration between APMEN countries. I know that Dr. Rose will have a lot to contribute to the coming discussions and to setting the agenda for the VCWG. I'm going to hand over to Dr. Rose if she's online, though she had sent a message saying that she's likely to be caught up in a meeting within the Ministry of Health. Leo, is Dr. Rose online?
I don't see her name. Dr. Rose, uh, if you are present and available, would you mind unmuting yourself and just letting us know if you are available? We understand that you've been asked to participate in an emergency meeting, and we'll accommodate that, of course. Mita, doesn't sound like Dr. Rose is available. So I think in that case, let's move to, we'll give Dr. Rose a slot a little bit later on, be a little bit flexible and just, move on to another part of the proceedings then. So to Amita, sincere thank you for those warm words of welcome, always very warm messages from you, Amita. Wonderful to hear that message from you, and also the background about the different working groups, etc. So I'm going to ask everyone, let's have a group photo, if you don't mind. Because of the technical, you can only fit so many pictures on the screen. I'm going to ask, when I say, okay, ready, steady, go, everybody look at your camera with a kind of a whimsical semi-smile on your face or broad smile, depending on your personal preference, and hold that for 1 minute, because Sam is going to then take snapshots of the different screens. And you don't know where Sam is in that particular process. So please smile at the screen for about 1 minute. I'll prompt you when to stop. Sam, are you ready?
Yes, please.
Okay, that's great. So ready, steady, go. Everybody with a great smile. Turn your video on, of course, and then great smile. Thank you. Dr. Sharma, you too.
Thank you. Thank you.
Sam, you got it all?
Yes, quite. Please give me 1 second.
All right.
Okay. I think some people are getting muscle fatigue. We'll give you a few more seconds, Sam. Okay. Almost done. Just hang in there for a few more seconds, please.
Okay, thank you, Kap.
Thank you so much. Thank you, Sam, and thank you, everyone. Okay, Dr. Rose, are you with us? Still not with us. Okay, I think let's everybody then mute and turn videos off. In that case, if Dr. Rose is not available right now, I think I should move on to giving that overview of the APMEN Vector Control Working Group activities since the last meeting. Let me see if I can remember how to share screen. All right. So hopefully everybody can see the shared screen there. It's a summary overview of activities since the previous annual meeting back in September 2018. A great big welcome to all of you for setting aside time to join us today and hopefully in days ahead. This is a special event where one can feel comfortable among like-minded colleagues with overlapping interests and shared concerns. So a very warm welcome once more. We'd like to ask you to contribute actively, share your ideas and concerns and suggestions as to how APMEN vector control working group specifically, but APMEN in general, can support the different countries in their objectives to reach malaria elimination. To backtrack a bit, I'm going to give this quick overview of activities. So as a quick refresher, APMEN is an independent organization that strives to support the malaria elimination objectives of its 21 member states. It has 50 partner institutions that we collaborate with. APMEN started way back in 2009. It is now fully integrated with the Asia Pacific Leaders Malaria Alliance, and the mission and vision kind of interact is to support and facilitate elimination of malaria across the Asia Pacific by 2030. So in addition to the higher level advocacy and those broader kind of objectives and activities, much of the more direct ground level, direct technical interventions and support of APMEN occurs through three working groups, specifically the vector control working group, and then there's also the surveillance and response working group, and then finally also the VIVAX working group. So a lot of changes have taken place in the core membership of APMEN and its working group since 2018. Go back to 2018, at that stage, there was the inimitable Dr. Effie Espino. I see you're also participating. You're present and LinkedIn, Effie. Wonderful to see your name. And thank you for what you did. Previously, ably assisted by Dr. Miu Min. Dr. Christina Rundy was our chairman at that stage, ably assisted by Dr. Pradeep Srivastava. I saw your face earlier on the screen as well, Dr. Pradeep. Great big thank you for the extraordinary efforts you've made over the years to support. Then there's the equally inimitable Dr. Jeffrey He, who was the technical lead for the Vector Control Working Group, supported by Tiff Damash, and then the admin officer, Sam Wanwal. Now, in 2021, we have the pleasure of having Amita Chebi leading the APMEN initiative as Senior Director, supported by Dr. Ponsi Hein as Program Manager. Then there's, as Amita mentioned, very recent appointment of Dr. Rose Nani Binti Mudin as our chairperson for the Vector Control Working Group. Wonderful privilege to have Dr. Rose on board with all her years of experience and knowledge as well. There's myself as the technical lead, Dr. Tinshaw Thu, Program Manager, Technical Officer Wulan, and then one carryover from 2018 is the ever reliable Sam as the admin officer. But you know, that small core team can only do so much, and the contributions that this Vector Control Working Group can facilitate, mediate, provide depends hugely on many others in the Asia Pacific vector community that are always willing to help without exception. I have never had anyone show any reluctance or trying to cop out. So there are some people that stand out. I don't want to mention, very reluctant at raising some names in particular, but I can't help but do so for Professor Tirapap Charianviriapap, who's been an incredibly staunch supporter in a sustained manner. There's, as I mentioned, Dr. Pradeep, and many others, Michael McDonald, lots of other people that have truly been very staunch supporters. So sincere thank you to you all. Just to give you an idea of the geographic area that the APMEN Vector Control Working Group tries to provide support to, it covers the whole of the WHO Southeast Asia region, the Western WHO Western Pacific region, which includes Papua New Guinea, and a part of the Eastern Mediterranean region as well. So if we use the 2019 malaria numbers provided by WHO, you will see that this area accounts for a relatively small contribution to the global malaria burden. 3% by the Southeast Asia region, which comes to 6.3 million cases, and 1.7 million cases in the Western Pacific. But to the people living in those areas, it is still a very serious public health threat. So we, following the guidance that was provided during the 2018 conference, in 2019, the Vector Control Working Group provided a range of different outputs, some of these including support for 4 competitively selected APMEN country partner nominees to undertake a 6-month diploma in applied parasitology and entomology course in Kuala Lumpur. APMEN provided the funding for a two-country trap comparison study for potential replacement of human landing catches. But our pride of place flagship output was an intensive 2-week intensive vector surveillance course hosted by Kasetsart University in Bangkok and fieldwork near Kanchanaburi, with 32 country partner participants from across the whole of Asia Pacific. Many more people applied for that course, but we had to whittle it down on a competitive basis down to 32 for practical reasons. Only so much lab space and so many microscopes available, etc. I should mention that Prof. Tirapap led both the trap comparison and the surveillance course, and he, as usual, he performed the tasks to perfection. Thank you, Prof. Tirapap. The Vector Control Working Group also developed, and thank you to TIFF for that, an online resource exchange network for entomology, and also Michael McDonald contributed hugely to that, which is that www.orene, O-R-E-N-E, web-based facility, which we've been tinkering with and refining ever since, and probably will continue forevermore. It's never ending. I'd like to encourage you to visit this site. It has all sorts of useful portals, information portals that you might find of interest and help. It has news, almost daily updates on news regarding vector control aspects, opportunities, job opportunities that we find out about, etc. It's all on that ORENE website. So if we come to 2020, like the rest of the world, our ambitious plans and schedules ended up in the dustbin because of COVID. It took us a couple of months to realize just how pervasive this COVID thing was becoming, and to find our feet again. But by April 2020, we were sort of running once more. And I think we were among the earliest who jumped on the Zoom bandwagon that everybody is now doing. We initiated a series of webinars with presenters from across the world, held roughly every 6 weeks. And they actually turned out to be very popular and well attended. And we're very grateful to our audience, a very faithful, loyal audience that joins in. And it includes many of you attending here today. So genuine thanks for joining those webinars. We also did quite a lot of work on development of a case study on community engagement, working on improving our ORENE website, planning for an online vector surveillance course that was forced on us But happily so, because of COVID, because we can reach a much bigger, broader audience that way than the face-to-face 32 people that we could previously, and then also strengthening collaboration with partner organizations. I mentioned the warm reception that our APMEN Tech Talk webinars received, and maybe I can just show you some interesting statistics, at least interesting to me and my colleagues here. Over the 8 webinars we've held so far, and sincere thanks to the 25 expert presenters who gave the various PowerPoints during those 8 webinars. We had in the order of 1,500 audience participants. Those people, most of them were from Asia Pacific, which is our target main audience, but a strong contingent from Europe, also Africa, and then understandably, because of time zone differences, far fewer in the Americas. Interestingly, about 32% of those participants came from an academic or research background. Very encouraging to see that about 26% of participants came from government agencies, national malaria control programs, and so on. And then tapering off NGOs, private sector, and so on down, but strong, significant, good participation by government agencies. That's very good to see. For this year, 2021, we've had very little choice but to continue in Zoom-dominated COVID virtual mode, but hoping that the vaccine rollout may enable some face-to-face training sessions again later in the year. So to summarize, we've been having a continuing series of APMEN Tech Talks, roughly every six weeks. And we aim to start a new thing in about 2 weeks' time. Towards the end of the month, we'll start an APMEN Journal Club, which will be interspersed between the different tech talks, to highlight and get the authors of very recently published vector-related publications to give us a short 10-minute presentation. Say 2 presentations per journal club session once a month. We'll try and have those. And I think it's the kind of thing I would enjoy listening to get one of the authors explain to us face to face what their findings were that they published in recent weeks. Then there's the APMEN Vector Control Working Group Conference, which is the one we're busy with now. We'll hope to complete the online Asia Pacific Vector Surveillance training course, which will be a certificate course presented on a virtual platform. We also hope to do some short, narrowly targeted vector surveillance courses based on the feedback that we get from you during our breakaway sessions on Wednesday, day after tomorrow, and on Monday. So the feedback we get from you will guide us as to how you view the priority training needs are that APMEN can support. So, we look forward to getting your thoughts and suggestions, and that'll help guide us where with the national malaria control programs and people involved in vector control are facing challenges and could do with a bit of, training support. Then hopefully also, if COVID allows, later in the year, much later in the year, November or so, in an intensive 2-week vector surveillance course, face-to-face. And then again, depending how much funding is left, possible research support, like we did in 2019 with a trap comparison study, contracting in specific small projects to support those. We'll also continue with our current post office, in inverted commas, function where we link country queries with expertise, countries sending through emails and asking if we can help, to help with particular aspects, development of strategic plan or something like. Then we link them with the experts and try and help out in different ways. People that want to buy cattle-baited tent traps or tent nets, find sources, try and help that way and serve as a post office, and continue with our partner collaboration as well. So just in case you want to have a look at some of our websites, I keep referring to that ORENE, ORENE, Online Resource Exchange Network for Entomologists, that particular website. If you can't remember them, just type in APMEN or ORENE in Google, and it should take you to those particular websites. So finally, I'd very much like to pay tribute to one of our very staunch, longtime supporters who passed away far too early in life this last March. And I think we all of those people who knew him, and there were many of you who knew Michael Bangs, we acknowledge the very high expertise and work that Michael Bangs had and delivered, but particularly his friendly camaraderie and great personality. So rest in peace, Michael. We miss you. We genuinely do. And then finally, in closing, I'd like to express our sincere gratitude to our funding partners. It's only due to the support from organizations and people like them that we're able to help you, our country partners. So thank you to UCSF, to CDC, Sumitomo, and thank you all, each of you, for joining us in the APMEN VCWG conference. What a great bunch of people. And please continue your support for our webinars. We'll keep on holding those webinars, and we look forward to you participating in those. So I'm going to stop sharing now, and then I'm going to ask if Dr. Rose has joined us. Dr. Rose, we understand that you were called away to an emergency meeting. No problem, no problem.
Hello,
I hope the meeting went well.
Yeah,
So
can you hear me? Can you hear me?
Indeed. So Dr. Rose, let me ask Amita just to recap briefly, to introduce you as our new, well, let me not put words in Amita's mouth. Amita, would you mind just reintroducing, excuse me, Dr. Rose?
Of course, happy to do it. Thank you, Dr. Rose, for joining us. I know you were caught up in, very important business, but really glad you could make the time. So before you joined us, I was just introducing you to, to all the participants, and was telling them about a bit about your background and your role in the Ministry of Health, but most importantly, the fact that you've been closely associated with APMEN for several years now. You're a leading champion, I think, for APMEN and a strong ambassador for the work we do here, particularly with a focus on coordination, collaboration, and cooperation between APMEN countries. So over to you, Dr. Rose. Thank you.
Thank you, Ms. Amita, for the kind introduction, and to Dr. Leo and to all our distinguished panelists and participants. I'm sorry that I was late because at this moment, we all know that we are actually in the situation of combating COVID-19 pandemic. So we are usually busy with the implementation of the vaccination program in our country, and also doing the prevention and control measure for all the cases that reported in the hotspot and affected area. So I would like to welcome everybody to this APMEN Vector Control Working Group Conference. I'm glad that I can join you all today, and I really hope that this APMEN Working Group can come up with with more ideas and innovations in sustaining and maintaining our control and prevention activity, especially during this hard time for us. So I know that there are many countries having difficulty in implementing their control and prevention activity because of these pandemic situations. But I believe all of us, we can go through this difficult time together, and we are willing to help the member country. And of course, we have all APMEN, Palma behind us, who always help the country, member country, to go through with this difficult time. And I believe the country can still achieve their targets to report zero human malaria, indigenous malaria. So I think our role as the vector control, APMEN vector control working group, is to support the member country to especially to ensure that the prevention and control activity can be done in whichever situations, and of course to achieve their targets by that particular time that they have put in their plan. Thank you very much.
Dr. Rose, thank you for those words. Please know, Dr. Rose, that you're highly respected, well, you know, with loads of experience and wisdom to share that we can learn from, and we're privileged to have you as our chair for the working group. We look forward to receiving your guidance and suggestions in your kind and warm way that you have, that's very special to you. We really genuinely appreciate you making yourself available in that position, despite your very busy schedule and life. So thank you, Dr. Rose. We look forward to working with you. Thank you for that.
You're welcome.
Thank you, Dr. Rose. Okay, so now we move into the first of our solid presentations, and it's a great privilege to welcome aboard Professor. It's a joint presentation by Professor Tom Burcott and Dr. Tanya Russell of James Cook University, all the way down in Australia, Cairns to be precise. The presentation will be by Professor Tom Burcott. It's going to be on, I think, the title is Capacity Strengths and Limitations for Malaria Vector Surveillance, Global Survey Results. Professor Burcott will be giving the presentation, as I said, and he's a member of the Malaria Elimination Oversight Committee of the WHO Global Malaria Program. And he's also a member of the Malaria Policy Advisory Group. So a highly respected figure in the malaria world. Thank you for making time available, Thomas. Thank you, and we look forward to your presentation. Over to you.
Thank you, Leo. I think one of the overarching themes of this year's conference is, I got the wrong screen share, I think. I think one of the big themes of the conference this year is vector surveillance. What can you see?
Yeah, we can see your presentation now, Tom. Maybe if you want to go full screen.
Yep.
Yep. Excellent. There we go.
I think
well
there's a couple of major themes to the conference this year, which is vector surveillance, which has been elevated by the World Health Organization as a core intervention, according to the Malaria Technical Advisory document, and also the concept of building capacity for vector surveillance and control. And I always say that the number of vector biologists are diminishing, the value is increasing, but we really need to do something to address this disparity. And so what I want to do is cover two things. First of all, I want to talk about a previous survey, a global survey that we undertook with the full support of the APMEN organization. I want to thank Effie and Miao Min, who were really instrumental in getting the APMEN countries to participate. So I want to report on that and give you an update on what we found from that survey. And then I want to go in and talk about what should come, what potentially could come next. And you've already heard that Leo talked a little bit about, we'll be doing a little bit of a survey on Wednesday on training needs in the APMEN countries. Now, this is the survey instrument which Tanya Russell designed, and it was available in English, French, and Spanish. And basically it asks countries to give us very high level information on what their vector control interventions they had in use, how they were monitoring intervention access and use. We asked about what sort of vector indicators were being measured and how they were being measured. We asked how data was managed and used in decision making. And we asked some questions about the national programs in terms of the capacity of the programs to undertake vector surveillance and control activities, the state of their strategic plans, and the techniques that they were using. And I want to point out and emphasize that we treated all the data that we collected as confidential. We did provide regional summaries, but not individual country data. And we asked questions, not quite, I'm told, I always call this metadata, but I've been told that that's incorrect. We asked high level data. So we would ask questions, do you measure insecticide resistance phenotypes every year in your country? But we never asked for any information on which insecticides you tested or what the resistance status was in your countries. So this is a very high level information to try to guide decisions on things like where we should invest in training, where are the needs are in the countries, and also where the strengths are. So basically what we provided or what we asked questions about were the inputs for the program. We asked about governance and finance, and the human resources available, logistics and infrastructure and information systems, and the activities that each of you are undertaking. So we asked about your work plans, your data collection methods, data management, reporting, and how you use that information in decision making. Now, we had 35 countries participate in this survey in 2018. And 14 of the countries were APMEN countries. And again, I want to re-thank Effie and Miao Min and APMEN Secretariat for their support, because they really made this easy. They got behind the survey and you all responded, I think, to the request to fill out the survey. Okay, so this is a very high level summary. Each bar represents a different country, and underneath it on the x-axis, I've noted whether or not that country reported themselves as being in the malaria control business, or whether they were in the eliminating phase of malaria control. The blue bars represent countries in Africa. The red bars are Asia Pacific Malaria Elimination Network countries, and the yellow are in the Americas. Now, there was 8 key vector indicators that WHO basically uses. We ask questions about, do you identify the mosquito species of your vectors? Do you measure their density, their blood feeding habit? Do you measure where they bite indoor or outdoors? And do they rest indoors or outdoors? Do you measure insecticide resistance? Do you measure infection rates in the mosquitoes? And questions about the larval habitat. So those are our key 8 indicators that we asked about. And the mean number of indicators of these 8s in the APMEN countries was 3. So there's some room for improvement here, but it's not all bad news. When we look at the individual indicator, the frequency of which they were measured, we would agree that measuring insecticide resistance phenotypes is probably the most important parameter, because all of our recommended interventions are based on use of insecticides, long-lasting insecticide treated nets and indoor residual spraying. And about 80% of the APMEN countries reported measuring insecticide resistant phenotypes every year. Again, the red bars are the Asian Pacific countries, then the blue bars are the countries in Africa. And you'll see overall, the indicators which I consider predominantly field collected data, the Asian Pacific countries were doing much better than the countries in Africa. There was very low measuring of insecticide resistance mechanisms reported, which isn't too bad because it's generally felt right now that we don't have enough information to be able to use resistance mechanisms to guide programmatic decisions. But that hopefully will change in the next few years. Now, we also asked about vector control strategies that are used by national malaria control programs. And this is over all 35 countries. And basically half of the countries said they had insecticide resistance management strategies. 2/3 of the countries reported they use integrated vector management, and about 2/3 said that they use their data for making decisions about vector control strategies. Now, 7 types of decisions were identified by the participating countries that said that they use the vector data, and these are listed here. They talked about using data, vector data, to make decisions on stratifying vector control choices. They talked about using it to decide which insecticide to purchase, on defining receptive areas that would require vector control. They used the vector data to identify sites for focal studies, to decide where IRS should be used, which long-lasting nets to distribute, and what sort of larval control strategy should be put in place and where. Now, we asked about national malaria control program capacity to implement vector surveillance and control activities. And the interest, well, if you look at this, the chart down here of the bars, the bigger the bar, the bigger the gap, the bigger the need. And we're comparing here vector surveillance capacity on the left to distribution of long-lasting nets and indoor residual spraying and larval source management. And basically, overall, only about 8% of the participating countries said that they had the capacity to undertake vector surveillance. And the biggest gaps in their programs was the lack of a strategic plan that told them how to do vector surveillance, and also limitations in the human resources to carry out the work. It's almost an inverse of the capacity gaps identified for distributing nets and using IRS, where logistics was the single biggest parameter in infrastructure, and followed by having insufficient manpower or insufficiently trained manpower. Now, the full set of information is reported in these 2 publications in the Malaria Journal from 2019 and 2020. So if you want to get more details on the vector surveillance that countries are undertaking, or on the capacity of national malaria control programs to implement vector surveillance, I can refer you to these 2 documents. Now, the key points, I think, which came out of this was there really was a limited number of vector surveillance indicators that were measured in 2018. So we had a median of 3 of the 8 key indicators as identified by WHO that countries were actually measuring. And there were some capacity limitations for surveillance. This was primarily, the biggest limitations were in the countries not having adequate strategic plans, and also limited by their human resources. The countries in the controlling phase of malaria identified logistics and human resources as their 2 biggest needs. And so I think this fits in a lot with the themes of what we're talking about in this conference, about the need for capacity building to allow us to do a more efficient job, and to work probably a little bit better within the manpower restraints that we have. I also want to make a key point, is that the need for local vector data is increasing. It's something that WHO has stressed in their high burn to high impact strategy and others, and that we really want to stratify what we're doing by the local epidemiological and ecological situation. And that really requires local data to make these decisions. So the importance of vector control data and vector surveillance data is going to increase in the future. Now, I want to talk a little bit about, spend the rest of the time talking a little bit about follow-on surveys. On Wednesday, the breakout groups will be undertaking some surveys, which Leo already referred to, on trying to identify capacity training needs and to prioritize that. But I also want to talk about carrying on a follow-up survey to the 2018 survey. And I think it'd be a very valuable exercise to use the results from the 2018 survey as a baseline to allow us to sort of track how we're doing as a region and how the countries can use this information to see how they're doing, how we're progressing. Are we doing a better job at vector surveillance in 2021? Was there an impact of COVID-19 on our activities, and what was the scale of that impact? We also want to use the follow-up survey to identify capacity training needs that we presently have. We can also use the results of this survey to advocate for better resources to allow us to do our jobs. And finally, I think oftentimes people look at a survey like this as something negative. But I think the other if we flip the coin, I think the other thing we want to get from a survey like this is to identify country strengths and to get countries to work together to support each other, because a lot of the countries have, particularly in the Asia Pacific region, have a lot of strengths in aspects of vector surveillance control, and that could really help their neighbors. Now, I'm going to try attempt, maybe I won't. I don't know if it'll work. Let me stop screen for a second, if I can. Okay, and share screen again. Okay, can you see the survey? Needs assessment for vector surveillance and control?
Yes, it's on screen. Thank you, Tom.
Now, this is designed by Tanya Russell with input from APMEN. Leo had a role in this, as well as the World Health Organization, the Pacific Community. A number of organizations provide input into the design of the survey, and really builds on the 2018 survey. And I just want to spend a few minutes now to walk you through the process to give you an idea. And basically what it asks, there's a few key things. We ask people to identify themselves, their position in the organization, which national area control program they work for, and their contact details, and whether there have to be the contact with phone. Now, it's designed to be specific for an individual country. So for example, if we say that if you work in the Pacific region, they'll then ask you which country will pop up. And so let's say we're working in Papua New Guinea. Don't take any of my answers as truth here. I'm just gonna be making it up as I go along. So you'll be asked if you participate in the survey, and if we decide that this is a useful thing to do, about how you would describe the malaria transmission situation in your country. They'll ask about your strategic response plans for mosquito-borne diseases, including anopheles control. And what's the name of the plan? When was it updated? And I was happy to notice that the Oreen Resources site has all the current national plans for malaria control in it. So that was a very pleasant surprise. So everyone seems to have an updated plan already. It asks questions about whether you need to revise your strategic plans or not, if you have guidelines for implementing vector surveillance or vector control. And you'll notice a lot of the questions look very similar, but one asks about vector surveillance and vector control. And so you have a chance to click on the boxes. It asks about whether your disease control program is centralized or decentralized. It'll ask some questions. So these are all about governance. It'll ask some questions about finance. Is vector surveillance included in the annual budget? Is vector control included? It'll ask you to make a decision about whether your budget is sufficient. In other words, do you get a sufficient budget to allow you to undertake all the activities in your national plan? Or is it less than sufficient that you're able to undertake some of the activities, or if you're severely limited by the finances that you receive? So ask that about both surveillance and control. It'll ask about your human resources plans, and it'll ask you to upload a copy of your organogram, and also ask if you could give us information on how many staff you have at the national level and the subnational level by different categories of positions, the managerial positions, the entomology officers, and so on. So, and you can just click on here to identify how many individuals you have. We tried to get rid of the previous survey that we did had a lot of open-ended questions, too many open-ended questions. I think it made it a little bit more difficult and longer to fill out. And we've attempted to minimize the open-ended questions here to make it easier for everyone to fill it out. So I asked questions about vector surveillance, staff numbers. Again, very similar to the questions that we saw above for vector control. And then ask questions about how many more people would be nice to have to do your job at the various levels in your organization. We asked questions about training and capacity building needs. And so we asked the assist, if you click on yes, do you have a system for staff training? It'll give you a chance to say how you actually, your staff is trained. And if you have something that we don't list, say other, and you'll get a chance to fill in the box. Okay. And this is actually a series of questions that'll be very similar to the questions you're going to see on Wednesday. You'll see a sort of a much shorter version of this, which we're asked to identify your country priorities for where you would like additional support on vector surveillance training. Okay, so you can identify things as high, medium, or low. And we'll collate all that information, which can help guide the sort of trainings that we can make available going forward. Okay, just want to flip down here. I don't want to take up too much time. We have questions, ask questions about the infrastructure and logistics, whether you have adequate infrastructure or whether you're limited in some way by a lack, say, of entomology supplies, or you might have sufficient transport. In the same way, vector control, the same sort of category. So we split out vector surveillance infrastructure from vector control infrastructure. So you have to read the lines a little bit carefully to make sure you're talking about surveillance or control. And we also ask how you collect information, how you store your vector surveillance information. And we'll hear a little bit about some ways of collecting information later on in the meeting on the new WHO sponsored system. So again, as you'll see, almost everything is you just have to click on a box. So if you say if you ask it on data collection, if you click on smartphone, sometimes other things will come up. It'll ask for, if you click on the use the smartphone, then it'll ask for additional information on the what apps or software you're using. In the same way for data storage and reporting. And finally, we'll ask we asked a few high-level questions about vector control activities, where they use insecticide-treated nets, indoor residual spraying, larval source management, or larviciding. Or do you implement other vector control activities? And if you click on that box, it'll list up some other potential interventions that are in use. And it's one thing we learned from the other survey in 2018 is that in the Asia Pacific region, we tend to be a little bit more creative, and we do other things that may not have the evidence base for a WHO recommendation. And you can also, if you're doing something we don't list, you can click on that. And then we asked a few questions about the COVID-19 pandemic, whether it delayed or prevented you from implementing vector control activities. And so we got a chance to say if it impacted which activities it actually impacted. And it's similar to saying for quality assurance of vector control, we ask if you did quality assurance, and if you measured net durability, or effective life of insecticide. And we'll hear a nice talk from Stefan Carl about quality assurance of long-lasting nets in Papua New Guinea a little bit later today. I think perhaps right after me. And again, we asked about how you monitor the efficacy of IRS applications and how you monitor impact of larviciding. And finally, we'll ask a little bit about vector surveillance activities. If you measure these parameters, these indicators every year or less frequently than annually, or if you've never monitored them. And how many sites that surveillance sites do you use? And what sort of methods you use to sample adult mosquitoes? How you identify specimens for both adults and larvae? If you, what facilities do you have as far as entomology labs? And then if you say you have an entomology lab, we'll ask a little bit more about the capacity of the lab. Again, it's all sort of click and move on. And how your data is used in entomological decision-making. So here's some possible ways that data might have been used, but you may have other uses for the data. And we ask a little bit about community engagement and operational research. And so that's basically the new survey that we're proposing to APMEN to hopefully consider recommending, and hopefully that if we do that, we can then track it back to the 2018 survey and see how well we're progressing. And I'm just going to close it at that. So thank you.
So, Tom, I think that was an extremely valuable and useful and well-explained presentation. Genuine thanks for that. You know, if our fight against malaria is largely based on vector control or reducing the interface between vectors and humans, reducing that contact, then we need to understand how effective we are in achieving that vector control and what is the capacity in our national malaria control programs to undertake vector surveillance being the basis, the foundation on which you make your vector control decisions and so on. So it's wonderful results there. It's alarming in many ways to see the extent, the breadth and depth of shortfalls that exist, but it's essential, it's critical to know and understand the distribution and of these different capacity shortfalls so that we can plan and try and rectify, ameliorate that situation. Because our fight against malaria is very largely based on vector control. And we better try and get that as right as best we can. So I just want to, I want to plead with our especially our National Malaria Control Program managers, but also our academics and researchers and everybody involved in vector control. Please participate in our discussions day after tomorrow and again next Monday, because Tom and Tanya, I want to assure you that APMEN will go full tilt in trying to help you implement this survey that you'd like to do, this repeat comparative survey later this year. What's the current status in relation to what the situation was in 2018? I think it's a wonderful, very worthwhile exercise. As you pointed out, it's largely a higher level kind of survey, very critical, and it does go down to a very great level of depth as well. But I want to assure our audience that on Wednesday and Monday, there will be different ways of tapping down at fine grain to try and identify some of the more immediate training needs that APMEN can try and help with in the immediate future, the next 6 months or a year, that we can start addressing at least some of the higher priority shortfalls. Priorities that you identified are your highest priorities, so that APMEN can help develop courses and invite participants from the National Malaria Control Programs to participate in courses that skills shortfall and capacity to fight malaria. So we have some time for questions, but I'm not seeing many questions pop up. I'm going to give a few minutes to see if there's anybody with a burning question you'd like to direct at Professor Burkhardt and Dr. Russell. But again, Tom and Tanya, well done. Great survey you guys did. Great results. Thank you for sharing.
I'll just add on this. In my role in the Malaria Policy Advisory Group, the question of vector data and capacity building, particularly, it always comes up in response to vector control, is a recurring theme. And it was suggested by Graham Brown at the last MPAG meeting, the closed session, that we have a special session on this in the MPAG meeting. So it's a very topical sort of thing. I think there's this global realization that undertaking that vector data is really important, can have a big impact, and that it's almost like a crisis point, the limitations imposed by the number of vector officers that we have in place in the countries, and particularly at the subnational level. I think it's really a critical shortage.
Absolute, very valid point, valid observation. So Indra, I think, made the interesting comment. Yeah, I think everybody agrees and is aware that there's a great shortfall in entomological skills and capacity and so on. Globally, it's not just in particular spots around the globe. It's all over the planet. There's a need for medical entomologists, not just in malaria, but increasingly also in arbovirology, etc. But for purposes of this meeting, it's pertinent to malaria. So there are some places where there are a good number of entomologists. So the question is, are the data needs and decision-making processes improved in those places where there are enough entomologists? So it would be interesting to, to have an answer to that question, because often it's not just having, a good number of entomologists. It's what data are gathered, how it's processed, how it's presented, how it's incorporated into the decision-making process. So, there are multiple points where there's room for improvement to make sure that entomology surveillance data does get incorporated and presented at decision-making platforms. So I'm trying to have a look here. Somebody's telling me there are two people raising hands. Now, I don't know where to look.
Yes, Arjun, gentlemen, please.
Okay, excellent.
Hi, thank you. Very, very interesting. I really enjoy your talk, Tom. Simple question. For all the survey, question one is that normally when you gather the data, who answer your survey? Because I think different country, even the NMCP, they have different way to manage the vector control. Okay, that number one, to ensure that we have enough data to move forward or get the training. And suggestion number two, I'm not entomologist, I have to declare, but I'm always interested to see which vector really transmit the parasite in my area. So I think for the vector control people, the guideline on how often they have to do the survey is important, because with different environment, the frequency may not be the same. And I think that would be useful from your experience. You know, if you're looking for the vector that transmit the disease at a certain time, how often they have to do, if you can come up with minimum suggestion, not maximum, okay, minimum suggestion, that would be practical. Yes, to think.
So
Yeah,
Tom,
thank you.
yeah, I'm going to leave you to answer that question, at least partly.
Okay, I just thanks, Jetson. Jetson, I think we first met in like 19.
No, 2008. That's the first APMEN.
No, we met
Oh,
back.
you
Way
mean you met in person? Oh, that long.
I was working. We don't have to go into that.
Careful,
So
careful, Tom. You're giving away Jetson's age now.
No. I like to say Jetson is a good friend that I've known for a long time, not an old friend. Yeah, it's a good question. There's a potential for real bias on this, depends on who answers the question, and I think I saw that Effie and Meow Min are on the audience, and we reached out. We worked through the APMEN, and we are. I think what we requested at the time was put us in contact with the head entomologists in the national programs. We do have that information. I don't think I can really share it. We could probably summarize it by the position that whoever filled out the survey. But there is a real risk of bias when you do these sorts of surveys, depending on who answers the questions. Yeah, and I think one of the things that we try to do with this survey is to respect the time that it takes to fill out a survey. So we tried to learn from our last lesson. We tried to minimize the sort of things that people have to type in the answers. So we want to get high-level data that can help maybe inform, you know, training needs, capacity needs, and how we move forward. So we don't want to take up too much time of the individual users. And certainly the questions about how often we should be doing those surveys, I think those that were really, they're not really it'd be interesting to know what people do, how often people actually measure these things. And we basically break it down, but do you do it at least once annually or less frequently? But, you know, those sorts of guidelines are sort of the specific guidelines that hopefully are captured in the individual country guidelines and national plans. And you're right, it's really going to depend on the vectors and the transmission and the manpower. You know, how much resources do we have that actually carry out these things? You know, I like yourself, I love data. You know, but it's the country staff have a lot of important jobs to do, and hopefully vector surveillance gathering of data is a high priority, but I realize there are competing interests.
No, I mean, in the survey, it's about, right, when they do the surveillance, you know, to gather the data of the vector to inform the strategy for control. In the guideline, you know, how can you develop the guideline for regional, that individual country may have different pattern of vector, right? So maybe if you have the general guideline that if they want to set up the schedule to do the surveillance for the country, they should base on some other information, for example, like the malaria cases or the environment or the seasonal or something like that. That would be helpful, the minimum thing that the country have to do. Because I work in malaria and still working in malaria endemic area in Thailand, the top 10 highest. And the part of the activity that they do, what kind of information they put in the data or the questionnaire, and what they really do in terms of survey to identify the vector, the transmission, the infection rate may not be the same, because they do not have the real pattern of when they should do the survey. Not
Dr.
answering the survey, yep.
Yeah, Dr. Jetson, I'm going to try and broaden the discussion a little bit, but just also to mention that on Wednesday in the introductory presentation, there'll be a discussion on the UCSF entomological surveillance planning tool. And there will be a lot of guidance to these kinds of questions. You know, what kinds of questions should be asked, and what are the data that are required to answer those questions, and that kind of thing. But Dr. Sharma, I know there was another hand raised, but you said you wanted to directly address this particular question. So Dr. Sharma, could you add?
Thank you, Dr. Leo, and excellent presentation by Dr. Tom. And my question, this is not a question actually. This is a one missing under vector control. He had mentioned about LLIN, other like larval source management. So my particular issues about larval source management, he has mentioned BTI, he has mentioned Temifos, he has mentioned insect growth regulators. In some Southeast Asian countries, we are a very good example of biological control agents like larvivorous species, Gambusia affinis and Posilia rapidoculata, which is most widely using under this malaria control program. So under that format, larval source management, so Tom, I request you to kindly include this biological control also, apart from IGR, Temifos, BTA. Thank you very much.
Sure. That's a good point. That's an oversight on our part, and I realize that biological control is an important component of a number of the countries. So yeah, we can certainly add that in as an option. I mean, as it is right now, it would require people to type in, larvivorous fish or something, but we can add that as part of the drop-down menu, certainly. Thank you.
Thank you, ladies and gentlemen. So let me, there's time for one more quick one. So Tin, I think there was another hand raised apparently. Can you see another hand? And only one more, please.
No hands are raised, Leo.
No hands are raised. Okay, then I think our time has basically run out for this particular session. So I'm going to ask that we now break for 15 minutes, a bathroom break, coffee break, tea break, leg stretch. Do whatever you need to do, 15 minutes, and then let's reconvene at 25 minutes to the hour. If you're a bit early, come back. There'll be a video playing in the background. So somebody is going to put on a video that will play in the background that will keep you occupied and distracted while you wait for the proceedings to continue again. Next up is going to be that excellent, I've looked at the PowerPoint, it's an excellent presentation by Dr. Stefan Karl. So please do return to your seat, and it'll be worth your while. So we break for 15 minutes. Thank you, everyone.
What is APMEN? Well, APMEN is a club, a network, a collaboration of countries in the Asia-Pacific region who are working in the near term or the medium term to eliminate malaria, to get rid of it completely.
In 10 years, APMEN has brought together a unique range of relevant stakeholders and created strategic partnerships for malaria elimination.
Provided a platform for essential knowledge exchange.
Strengthen national and regional capacity.
Trained hundreds of National Malaria Program personnel and built technical capacity.
Developed technical working groups on vector control and surveillance.
Supported implementation research for safe and radical cure of Plasmodium vivax.
Championed regional leaders through the APMEN Fellowship Program.
Redefined the malaria public health landscape. Created a fertile ground for South-South cooperation.
and supported the development of a network that is owned by the countries and for the countries.
APMEN has come a long way in its first 10 years. We've had our fair share of successes and setbacks. We can look back and
What is APMEN? Well, APMEN is a club, a network, a collaboration of countries in the Asia-Pacific region who are working in the near term or the medium term to eliminate malaria, to get rid of it completely.
In 10 years, APMEN has brought together a unique range of relevant stakeholders and created strategic partnerships for malaria elimination.
Provided a platform for essential knowledge exchange.
Strengthen national and regional capacity.
Trained hundreds of National Malaria Program personnel and built technical capacity.
developed technical working groups on vector control and surveillance.
Supported implementation research for safe and radical cure of Plasmodium vivax.
Championed regional leaders through the APMEN Fellowship Program.
Redefined the malaria public health landscape. Created a fertile ground for South-South cooperation.
And supported the development of a network that is owned by the countries and for the countries.
APMEN has come a long way in its first 10 years. We've had our fair share of successes and setbacks. We can look back and be proud of
Hi, Leo. We are reconvening.
So hello again, everyone. Hope you enjoyed your break, did what you needed to do. So we're going to move on now for a presentation by Dr. Stefan Karl. Hi, Stefan. I see you.
Hello.
There. Yeah. Of James Cook University in Australia. He's going to be talking to us on quality control of long-lasting insecticidal nets. Are we neglecting it? So Dr. Karl is a group leader at the Australian Institute of Tropical Health and Medicine at James Cook University. And he's also the head of the entomology section at the Papua New Guinea Institute of Medical Research. And in addition to his strong interest and involvement in vector control issues, Stefan brings with him the expertise he gained from his master's degree in process engineering, and he also has a PhD in biophysics. So very impressive, Stefan. We look forward to your presentation. Please go right ahead, Stefan.
Okay, I'm going to just try and share my screen.
Okay.
Can you see it?
Yes, it's on screen. Thanks, Stefan.
In presentation mode, yeah. Okay, thanks so much. Okay, thanks so much for the invitation, and it's a pleasure to present here. I'm going to talk about quality control of long-lasting insecticidal nets and whether we are neglecting that. So just as a way of introduction, long-lasting insecticidal nets, or LLINs, are the largest item in the global malaria control budget, and over 2.2 billion long-lasting insecticidal nets for malaria control have been delivered to recipient countries so far. The number of nets delivered per year is approaching 300 million. The costs for LLIN procurement and distribution make up over 50% of the annual global malaria control budget, and that's compared to about 15% for diagnosis and treatment. About 95% of the LLIN market is donor funded, and there's currently about 22 WHO pre-qualified LLIN products from 12 manufacturers. That's a steep increase from 2 products in 2005. The average cost per LLIN has reduced from $5 to $2 in the last decade. It's important to note that all currently pre-qualified LLIN products for public health use have a pyrethroid as the main active ingredient. And just to put it into perspective for PNG, because that's where we work, there's in PNG around 1.3 million LLINs are distributed each year. And the average cost for a net delivered is about $5.70. Yet malaria rates have increased significantly over the last few years there. So a slide on pre-qualification and quality assurance processes for LLINs. So in order to be eligible for donor-funded procurement and distribution schemes that make up 95% of the market, LLIN products must attain and retain WHO pre-qualification status, it's called, by passing safety, quality, and efficacy benchmarks. And then there are pre-delivery inspections that further test product quality before distribution. So if you look at that in a schematic way, a simplified way, you have a candidate product and that has to undergo a pre-qualification process, it's called. That's a multi-year, quite onerous process in which the nets are tested in the laboratory and in the field, and whether they are basically complying with these guidelines set out in these WHO guidelines for laboratory and field testing of long-lasting insecticidal nets. And if they pass that process, they are taken up onto the WHO pre-qualified list, and that makes them eligible for donor-funded procurement and distribution. And then basically they undergo tender processes in which mostly the cheapest nets are chosen, and then prior to mass distribution in recipient countries, they undergo pre-delivery inspections, which are basically spot checks in which the key parameters, chemical and physical parameters of the nets are verified. So what kind of tests are basically being done in these different stages of pre-qualification and quality assurance? In the pre-qualification process, biological, chemical, and physical properties are tested. For biological testing, cone bioassays, WHO standard cone bioassays are the primary test, and so-called tunnel tests are an alternative test. Then we test for total insecticide content, and then we test physical properties like wash resistance, physical strength, etc. In the pre-delivery inspections, it's important to note that we don't test for biological efficacy, and we restrict ourselves to chemicals, so total insecticide content, wash resistance, and physical strength, and etc. So according to WHO guidelines, in order to gain pre-qualification status, LLANs should achieve one of the following criteria after 3 years of use in the field or after 20 washes in terms of bioefficacy. That's 80% mortality in Cohen bioassays, 95% knockdown in Cohen bioassays, 80% mortality in tunnel tests, or 80% blood feeding inhibition in tunnel tests. So you can see there's plenty of alternative pathways of how these products can basically gain pre-qualification based on their bioefficacy. It's important to note that all currently pre-qualified LLIN products were PQ listed first based on passing Cohen bioassays alone, and that includes Olicet, which is the only permethrin-treated product currently on the pre-qualified list. So what's the difference between these Cohen bioassays and tunnel tests? In Cohen bioassays, we expose mosquitoes directly to netting for strictly 3 minutes and measure the proportion of mosquitoes that are knocked down and killed after 60 minutes and 24 hours, respectively. In tunnel tests, we basically expose mosquitoes for 12 to 15 hours overnight and allow mosquitoes to pass through a piece of netting in which small holes have been cut to feed on a small bait animal on the other side of the so-called mosquito tunnel. And then we measure the proportion of mosquitoes either blood-fed or the proportion dead. So we have an exposure time of strictly 3 minutes in the Cohen bioassays versus an exposure time of 12 to 15 hours in the tunnel tests. Just keep that in mind for the slides to come. So why are we talking about quality assurance for long-lasting insecticidal nets? So that goes back to our observations in Papua New Guinea, where we observed that despite this framework, new and unused nets did not perform as expected in WHO Cohen bioassays. In fact, we observed very low and variable knockdown and mortality rates with pyrethroid susceptible colony mosquitoes in nets that were manufactured after 2012. And this is despite all nets having the adequate total insecticide content as measured by HPLC, CPAC method, and X-ray fluorescence microscopy. So since the start of the bed net distribution campaigns or the mass distribution campaigns in PNG, only one brand of nets was distributed, and that's Permanent 2.0, which is a deltamethrin-coated polyester net. So here in these graphs, in the leftmost graph, you can see the original data from the PNG Institute of Medical Research. Just the mortality data here, but knockdown looks exactly the same. All the nets up to 2012 basically killed more than 80% of mosquitoes, and starting from 2013 and onwards, we observed this very low and highly variable mortality rates. These data were confirmed in various different labs internationally in blinded confirmatory assays on exactly the same sample. I'm just showing one of these confirmations here from the Ifakara Health Institute, correlating the mortality data from PNG IMR. And you can see a very nice correlation basically confirming our data. Since then, also data from independent other studies that we have nothing to do with came out that also corroborate these findings. So here's a study also on Permanent 2 from Nicaragua, where you see that 6 months after distribution, these nets already have a negligible bioefficacy in Cohen bioassays, 24-hour mortality. Basically, all of these box and whisker plots here, 3 years after 3 years after distribution should really be above this 80% threshold. But what you can see is that even after 6 months, none of these nets basically achieves the 80% Cohen bioefficacy. And it should be noted that half of these nets, if you actually read the paper, half of these nets in these 6 months box and whisker plot here have never been watched either. So if you translate that then into basically compliance with the Cohen bioassay criteria, so either 80% mortality or 95% 60-minute knockdown, you get this kind of graph where you see that 100% of the nets complied with these criteria up to 2012, and then only 17% of the nets complied with these criteria from 2013 and onwards. And if you look at the malaria case numbers in PNG, you can see a similar trend. We are not saying that this trend is directly related to these observations, but I'm just highlighting the temporal correlation of these two observations. And we published this data, this bioefficacy data here in this paper last year. So that then triggered us to further look into other changes that we could see in these nets that we had collected. So this data is basically from exactly the same nets. We can see chemical changes, physical changes, and ultrastructural changes that have taken place over the years. We can confirm that basically the total insecticide content in these nets, which is here the red dots, the delta methrin, is as specified throughout the years, so there's no change there, but we can see other chemical changes here. For example, the chlorine content in these nets decreased dramatically over the years. Now we don't know what that actually means, but it just confirms that there have been chemical changes to these nets. We see physical changes in terms of weight, so the bales of nets weigh less and less every year. And we also see ultrastructural changes in terms of the delta methrin crystal size distribution on the filaments, on the polyester filaments deposited on these filaments. So in the nets that are actually working, the pre-2013 nets, these delta methrin crystals are much, much smaller and more evenly distributed, whereas in the nets that are not working post-2012, the crystal sizes on average are larger and the crystals are more clumped together. We have also made the observation that it is very easy to actually manipulate Cohen bioefficacy in these nets. So if we take permanent 2.0 samples with severely decreased bioefficacy from PNG, say for example from 2019, and we heat them for 5 minutes at 120 degrees here, that we can basically achieve a sustained and significantly increased bioefficacy as observed in Cohen bioassays. So these graphs here just basically show that you have a certain 24-hour mortality or knockdown before the heating process, and then directly after the heating process, you get a 3-fold increased bioefficacy, and that remains for 70 days here. I show it, but now we also have data for 1 month and 3 months, and it's a permanent increase that you can achieve. So this basically should have some implications for quality assurance using Cohen bioassays, because it's very easy to change the bioefficacy of these nets using some very simple assays. And that goes back to this paper here published late last year in PNAS, where the authors basically describe heating of technical grade delta methrin and the associated changes in insecticidal potency that go along with that. So what kind of impact did this have on the LLAN distribution in Papua New Guinea, these observations? So the National Malaria Program then in PNG, which we worked together very closely with, then requested other nets, different net brands for distribution in PNG, and we are continuing to test substantial numbers of these nets for all products that are basically distributed in PNG. So currently that's mostly SafeNet, YaheNet, and Royal Sentry. And I just have some data here on the right-hand side where we can compare a little bit the 24-hour mortality for these different net brands. And you can certainly see that there's a range of mortalities that we can observe. I just also put the permanent 2 mortalities here again for comparison, but you can see that many of the other brands depicted here also don't really achieve on average this 80% mortality in these 24-hour mortality assays or Cohen bioassays, but some of the brands, in particular Royal Sentry, seem to achieve that and consistently exhibit 100% bioefficacy, like the permanent 2 from before 2012 consistently does as well. Now, it's very important to highlight that this does not impact the importance of LLANs. They remain the most important vector control tool against malaria and PNG, and this is not what we're saying. We're just highlighting these observations with respect to the bioefficacy. So based on these observations, we reviewed the current guidelines of quality assurance and practices for long-lasting insecticidal nets. And I guess this slide is about just highlighting the most important weaknesses that we perceive in the process. So it's obvious that there has been chemical and physical changes in these permanent 2 nets, which have resulted in reduced bioefficacy. There's no doubt about that. But it is currently unclear what the mechanisms are to actually report post-pre-qualification changes to LLIN products and to verify continued bioefficacy. But given that these nets have been distributed in PNG since 2013, we must assume that currently there's no such mechanism in place. The total insecticide content in LLINs is not correlated to bioefficacy. Thus, current pre-delivery inspections are not suitably equipped to identify substandard nets because they only measure total AI content. And if that's not correlated to the actual bioefficacy, then that will not tell us whether these nets are actually going to end up killing mosquitoes or not. The third thing is that cone bioassays and tunnel tests are currently assumed to predict equivalent bioefficacy. However, as I said in one of the previous slides, in tunnel tests, mosquitoes are actually exposed for 12 to 15 hours overnight, whereas in cone bioassays, exposure time is strictly restricted to 3 minutes. In addition, all currently pre-qualified LLIN products achieve PQ status based on cone bioassays alone. And it's just very clear that tunnel tests and cone bioassays do not actually predict equivalent bioefficacy, especially for pyrethroid-treated nets. Bioefficacy of LLINs can easily be manipulated, for example, by heating the nets for 5 minutes at 120 degrees, as I have shown, as that significantly increased knockdown and mortality permanently. And current guidelines are outdated as they do not include methods to test LLINs with alternative chemistry, for example, pyrethroid-resistant chemistries directed against pyrethroid-resistant mosquitoes. And I guess then we came up with some suggestions for how to potentially improve the LLIN quality assurance processes. And those are summarized in this paper that has here the same title as my presentation that I'm currently giving. And I'm just highlighting the most important ones. If you are interested in all the other things, then please check out this paper. So I'm just highlighting the most important, suggestions here. The first one is procurement should really shift from a price-focused procurement to a system that actually rewards quality and cost-effectiveness of LLINs. Now, how do you measure cost-effectiveness of LLINs? That's very difficult. We recognize that, but that's not really our problem. LLINs should continue to meet the biological performance indicators that they met when they were first PQ listed. And the chemical content should not be used as a proxy for bioefficacy. We see the need to invest in developing standardized chemical assays that actually measure surface bioavailability, as we believe that that is probably a much more accurate predictor of bioefficacy than total insecticide content. Pyrethroid-treated nets should pass cone bioassays against pyrethroid-susceptible strains without the need for tunnel tests. And national malaria control programs in recipient countries should be enabled to conduct these tests. And if they report, observations that call into question the performance of specific products, then that should trigger some kind of mechanism in which that is further investigated. And with that, I would like to thank you very much for your attention, and I would like to thank the people involved, in particular the team from the PNG Institute of Medical Research, first and foremost Naki Bubun, who's really been working tirelessly on these bioassays. Our partners from the PNG National Malaria Control Program, Mr. Leo Makita, Tim Freeman from Rotarians Against Malaria, who basically distribute all the nets in PNG, and our partners from academia here from Ifakara Public Health Institute and Liverpool School of Tropical Medicine, and also our funders, and thank you again. Might just stop sharing my screen.
Yes, please. Thank you so much, Stefan. That was a highly interesting, but equally also quite disturbing presentation to see the failures in bioefficacy so rapidly within 6 months after user application. So thank you for that. So I'm not quite sure, I don't see any hands up, at least on my screen. I did notice in the chat box or a question by Prudence Hamade asking, Dr. Prudence asking about the extent to which end users are consulted during the initial pre-qualification or subsequent processes about user acceptance and so on. Stefan, I'm not sure if you're able to just say a word or two about, to what extent is there community or public consultation involved in the texture, the color, and other factors that determine usability and acceptance by end users?
So as far as I know, this is sort of part of the pre-qualification assessment to some extent. So there, the nets really have to be tested for 3 years in field under field conditions, and there's survey questionnaires and stuff like that associated with that process. So I think that some of these parameters are actually, data on some of these on some of these parameters is actually measured there.
Yeah, so that's good to know. It's just, and I suppose one can't always satisfy everybody all the time, but there are regular questions about this. People may not like the particular color or the texture or so on of particular brands of nets. So I think that's the basis.
Hi, Leo. We have Marion.
Okay, can you read the question, please, Tim?
Marion, could you please ask the question, please?
Well, good morning, colleagues, and thank you very much for the invitation and also that very interesting presentation from Dr. Karl. Being the team lead of the WHO pre-qualification, I feel I must make a few comments. Obviously, we didn't get any pre-notification of this work or whatever. I have reached out to you, Dr. Karl, to talk further about this, and hopefully you will find some time to reach out to us. But I don't have a specific question, and I will keep my comments very short, but I think they're important to make from our perspective in WHO. The first one is the title, Quality Control of Long-Lasting Insecticidal Nets, Are We Neglecting It? My first comment would be, and as Dr. Karl and his colleagues pointed out, I think absolutely this area has been neglected. You pointed out right back to 2001, there have been issues. So I would absolutely agree they have been neglected. I don't think they're being neglected anymore. And hopefully, and this is a plea, maybe APMEN would like PQ to come and talk about the work that we are doing with LLINs, which is a priority in WHO. I've already presented some of this work to a number of stakeholders and also MPAG Group and VCAG. So we would very much like the opportunity to take you through exactly what we must do. The other comment I want to take is when we use the word quality control, and this appears like splitting hairs a little bit, but before you can have appropriate quality control, you must know what you understand to be appropriate quality. And for PQ, that is a huge part of our job. It's an enormous part of our job because this has not been done to a huge extent before. And I am finishing, sorry, but this is important for us. When we look at quality, you must look at the quality of the formulation and the active ingredients and everything that goes along with that, including the chemical and physical properties. Very, very importantly, as you all know, for the nets, we must take into consideration the material and how that formulation is applied to the net, we must make sure that appropriate specifications are set, and that is confirmed through the manufacturing process and the inspections that are set up to do that. And then there is a paper review of all the data. But as you've quite rightly presented, Dr. Carl, then that needs to have and I'll call it P-qualification at this point, but other governments register or approve these products too. So everyone has an interest in getting into the field to do that. But you must know what you're looking at. So, I mean, we could talk very much all day on this, and I hope we're given the opportunity, because it was good to speak for ourselves and not have others do that. But one question I must answer, and it was your question, Dr. Carl, do we know about any changes that are made to products? Absolutely, we do. It's the processes. There are two processes. We receive complaints, which we investigate. That's a standard process in WHO. And in fact, we have looked at a number of complaints for NETs. And also there's change applications that change the formulations. We must know what happens there. We must have data to support that. I would just say, though, that we have only been doing this for 2 years. So, 2018, it's now 2021. We've got a big job ahead, but I would like to just say we are not neglecting this area, and we appreciate the opinion piece. It's obviously maybe raised interest around this, because we are not often successful in getting our message across. So I appreciated that, and we hope that you'll be able to connect with PQ, because we may actually have very good information for you. And likewise, I would hope one day we get that information too to help us. Thank you very much, and I know I took a long time. Apologies
Marianne,
for that.
yeah, we need to end there. So, but thank you sincerely for that very thorough, I won't call it a rebuttal, I'd rather say clarification or background from WHO perspective. Very useful background and worth pursuing. Thank you for your offer to participate and share more information about process and everything else, perhaps during an APMEN Tech Talk. We'll take you up on that, so watch your inbox. Stefan, I'm sorry, we've run out of time, so I'm not going to offer you time for rebuttal. Not for a response to Marianne, but except to say sincere thank you for a great presentation. Thank you, Stefan, much appreciated.
Thank you so much.
Thank you, Stefan. We're going to move on to Dr. Kalpana Barua, who is Joint Director of the India National Vector-Borne Disease Control Program. Dr. Kalpana is going to give us a presentation on vectors and vector control in India, current practice and challenges. Dr. Barua is head of the Entomology and Vector Control Division of the National Vector-Borne Disease Control Program in India. She's also the focal point for dengue, chikungunya, and Japanese encephalitis. So, Dr. Barua, thank you so much for your time and making yourself available to share something about the India program on vector control. Over to you, Dr. Barua.
Thank you, Leo. Good afternoon, good evening, good morning to all. In the outset, I would like to congratulate the APMEN for this organizing annual conference of the Vector Control Working Group amidst the COVID-19 pandemic. Especially Dr. Rose, Amita, and Leo, you have taken all the pain, I believe. I'm also grateful to APMEN for having me here, and it will be a great pleasure to share the experience and status of vector control in India with the galaxy of experts. With your permission, I would like to share my screen.
Yes, please, Dr. Barua, please go ahead.
Thank you. Is it visible?
Yes, and now you're on full screen as well. Excellent. Thank you, Dr. Barua. Please go ahead.
Okay, thank you. Malaria with other 5 vector-borne diseases are managed by National Vector-Borne Disease Control Program in India. So this is the situation of malaria over the years in India since 2000. it is quite visible that you can see these cases, whether it is PF or falciparum cases or Vivex cases, they're declining. So is the malaria, deaths due to malaria is declining over these 2 decades. So what are the strategies for malaria control in India? Parasite elimination and disease management. We have early case detection and complete treatment, then strengthening of referral services, then epidemic preparedness and rapid response. For integrated vector management for transmission risk reduction, we are having a battery of tools like indoor residual spraying in selected high-risk areas, use of LLIN, saturating the subcenters which are having API 2, and now we are shifted to API 1. Use of larvivorous fish, anti-larval measures in urban areas, minor environmental engineering, then entomological surveillance through the by the state and through 84 zones of entomological zones and through institutes, as well as the cross-cutting interventions like behavior change communication, human resource development through capacity building, then strengthening of supervision through this district level, there's vector-borne disease consultants and malaria technical supervisors, then monitoring and evaluation, drug resistance monitoring, insecticide resistance monitoring, intersectoral collaboration, partnership with NGOs and public-private partnership mode. We have adopted for this program in various places. So India's malaria elimination goal, it is to eliminate malaria to 0 indigenous case in the country by 2030 and sustain the malaria-free status and prevent reintroduction of malaria. What are the strategic goals we are having? Is eliminate malaria by 2022 in all those areas where the cases are, it is the API is less than 1. They are categorized into various categories. I'll come to that. And all the remaining districts with API 2 has to be brought out to the pre-elimination phase and maintain malaria-free status in the areas where malaria transmission has been achieved and uninterrupted, and prevent reintroduction of malaria by strengthening the surveillance. So as I have mentioned about the category, the states in India has been categorized into 3. Category 1, 2, and 3. The hardcore areas are in the category 3. There are 10 states where our target is to achieve the elimination by 2027. And there are 10 states, and category 2, where it is API less than 1, but some of the districts report API more than 1 cases per 1,000 population. There are 11 states. Their target was given by 2022. And category 1, the maximum states, you can say it is 15 states where the achievement was to be by 2020. So what are the IVM strategies for all these different categories of states we are having? So for category 3, LLINs, that is universal coverage in areas with more than 1 API. IRS, if not covered with LLIN, but mostly it is IRS, LLIN has been given. Then larval source management, then larviciding and biological control in the urban areas of those areas, then environmental management, advocacy, insecticide resistance monitoring and management, entomological surveillance. In the category 2, similarly, you can see that 2 rounds of IRS, then anti-larval in urban areas, source reduction, biological control, minor engineering, larviciding, then insecticidal spray in the focal spray during the outbreak if certain areas are reporting, advocacy and entomological surveillance. Source reduction, and for category 1, similarly, source reduction, biological control, and almost a similar type of, but here LLIN is not given in these areas. And then your this IRS is also not routine, only the focal spray is there. So with those categorization and having the introduction of India's National Malaria Framework and its elimination plan, if you see from 2015, so cases have declined in 2019 by 21% as compared to 2018. So malaria death is also reduced by you can say 19.8% in 2019 compared to 2018. And in 2020, it is last year, approximately 46.3% decline in malaria cases and 26.6% decline in falciparum cases and 18% in deaths. But we should not forget the last year it was COVID and we had, and there is no constraint of the surveillance also. There was a reduction of almost 32% of surveillance in many of the areas. As on average, I mean 32% was there. And if you see the malariametric indices of India, since 2012, India has sustained the API at less than 1 at the national level. So coming to the vectors of malaria in India. So we are very rich. We are having 9 vectors. 6 are primary vectors. That is Anopheles kilicifacis, Fluviatilis, Stephensi, Bimide, Minimas, Epioticus. And then secondary vectors also we are having Anularis, Philippinensis or Nivipes and Varuna. And all these are playing somewhere in major role or somewhere some secondary role in the areas in the transmission of malaria. So what are the, there's vector intervention measure we are having for malaria and the insecticides and formulations which we are using under the program. You can see maximum insecticides are used for IRS. We have DDT 50%, WP, then malathion, then synthetic pyrethroid, delta. We are having deltametrin, cyflutrin, alpha-cypermetrin, lambda-cyhalothrin, and bifenthrin. These are under the program. So indoor space spray during the outbreak where cases are occurring there, pyrethrum extract and cyphenotrin inside the houses. If it is covering a large area, then we advise for outdoor fogging, otherwise not. And for that, we are having malathion technical and cyphenotrin. Larviciding in the urban areas, there's use of MLO since the beginning of the program. You can say it's a long, use for a long time. Then Temefos is there. Biological control in selective areas and BTI is also used. Then long-lasting insecticidal nets, synthetic pyrethroid. We are having only single this synthetic pyrethroid and LLIM because we have not shifted to the synthetic pyrethroid or PBO or any other synergies till now. And if you see this indoor residual spray with DDT, it was the mainstay for vector control in India since inception. And recently only we have shifted to this LLIN. So having said that, if you see the use of DDT, which was the primary, this intervention and the main insecticide use, now it is gradually the use has been declining as per India's commitment to Stockholm Convention on DDT use. We need to phase out DDT. If you see in the beginning, 1991, 92, then up to this 94, 94, more than 12,000 metric ton of DDT was procured and provided to the states for indoor residual spray. And gradually it is declining. And in 2021, just more than 1,100 metric ton of DDT has been approved by the mandate group for DDT use in the country. And probably within 2-3 years, it will be completely phased out. Of course, we are having other insecticide as I discussed for this IRS. Some states are already, they have shifted for the synthetic pyrethroid for this IRS. So from IRS, we have shifted to LLIN. It was a paradigm shift in vector control. Initially, it was ITN was used in 1997-98 when India received the externally aided component with the support of the World Bank. There's no bed nets where plain bed nets were procured and synthetic pyrethroids were procured and provided to the states, and they were trained how to treat on that, and they were used. And recently, as I said, in 2009, the program shifted to LLIN. An amount of LLIN procured under the program, you can see from this graph, I mean this bar diagram, we are just increasing the there's no quantity, and our target is for universal coverage by LLIN, all the these hardcore areas, high risk areas, so that malaria transmission can be interrupted. So we are having many challenges in the malaria vector control in the country. The first and foremost is a diverse eco-epidemiology of the country. You can see the country, it is a subcontinent, you can say, so big. Multiple vectors we are having. Emergence of insecticide resistance towards locally used insecticides. This is also one of the biggest, hurdle. Then quality of this indoor residual spray, because quality and coverage, these are the, these are the criteria. If we are not monitored properly, then the IRS is not going to pay any dividend, whatever the amount of insecticide we use. Socio-cultural practices like mud plastering and all immediately after the spray, or somewhere some sericulture practice are also there, and people are a bit reluctant for this IRS acceptance because they have been getting the IRS, as I said, from 1950s. And for LLIN use also, high temperature and humidity sometimes limit the use of LLIN. And I think I'm audible, no?
I'm sorry, say that again, Dr. Kapana?
I'm audible, no?
Yeah, no, you're doing very well. Everybody's rapt with attention. Nobody wants to interrupt you, yeah.
Okay,
please go ahead.
Sorry. So high temperature and humidity limits the use of LLIN by the community, particularly in the eastern part, and there's where humidity is very high. Then occupation linked malaria and migrant population, this is also giving a tough fight. So changing vector binomics in certain areas, the vectors are changing their binomics. From the late biting, they are shifting to the early biting, or they are shifting to the outdoor biting. And we need operational research to evaluate vector control impact of these these interventions. But inadequate manpower is the biggest challenge in front of us, and all these issues now which I have enlisted, these challenges, maybe it is the outcome of this inadequate manpower only. So exactly what we are having, the infrastructure in the country for the entomological surveillance and the vector control. If you see, we are having in 1977, realizing the importance of entomological surveillance when there was a resurgence of malaria in the country. In that time, 72 entomological zones were created in various states to cater for this, there's a population. They are suffering from malaria, so that the entomological issues are monitored and vector control is implemented in those areas. So these entomological zones now, it is 84 zones are there. Entomological surveillance, then there are there's vector prevalence, then their density and insecticide resistance monitoring. All these activities are to be carried out by these entomological zones. And this one zone they cover, initially it was 3 to 4 districts, but now when the number of districts have increased, now at least their one zone is having, there's 7 to 8 districts. This is humanly not feasible. So state entomologists under VVD program is existing. Their activity is to implement the IVM strategies, then entomological monitoring, quality assurance of IRS, evaluation of LLIN use, and outbreak containment. We have 19 regional offices of health and family welfare under Government of India. Each regional office are, they are linked with 2 to 3 states, and we have entomologists there, and there's function is to backup support to the states linked with and supervision of IRS and entomological monitoring. Then we have one integrated disease surveillance program in India. Under that program, 21 positions of entomologists were created. Of course, we don't have all these posts filled up, but wherever they are available, there are 17 entomologists available now. They are supplementing to the states. Some municipalities are also having their entomological setup, but not all. Only the large municipal bodies they are having. And at the headquarters also, we are having 9 entomologists, and I'm the last one. All posts are vacant. So their responsibility is evidence-based policy decision, then monitoring effectiveness of vector control tools and insecticide, technical guidance to the state, to the government for policy, and then outbreak containment. Knowing this, India has developed one, there's a mosquito and other vector control response aligning with global vector control response, wherein we have emphasized the need for strengthening entomological HR to achieve the VVD elimination. 3 VVDs are targeted for elimination: malaria, then Kala-Azar and filariasis. All 3 diseases has to be eliminated. So we need the entomological HR and to sustain the achievement. So from 84 zones, we need to have minimum 250 zones, and filling up all these vacant posts we have emphasized. And for the zones, we have started working on it. Currently, all those 84 zones where there's manpower is lacking, at the first phase, we are trying to fill all those posts, and the remaining zones in a phased manner, we will be filling up, creating and filling up the positions within 2-3 years. We are having this National Center for Disease Control. They also supplement the program with that minimum entomologists they are having at the headquarters and their branches. And Indian Council of Medical Research, they are also having entomologists, but their main focus is on this operational research. They supplement the program with this insecticide resistance monitoring and whenever some need arises. Now coming to the this IRM, so because we are having so many insecticides, synthetic pyrethroids and DDT, malathion, all these are we are using. So insecticide resistance is inevitable. So this map is, this data has to be updated. But even then you can see a colorful map of India. And if we update it, then most of the areas will be filled up with colors. So timely sharing of the data by these, ICMR or institutions or other institutions or universities, wherever they are conducting the there's a insecticide susceptibility test, or they are generating the data. If they share with the program can change the strategy with that evidence, and that's why it is very important. And our zonal team and in the state level, since we are having large vacancies, that's why there's no regular IRM is the biggest challenge. And report of synthetic pyrethroid resistance in some, has been documented in some publication we have gone through. And in the elimination phase, this will be a very critical issue because we are using LLIN in a big way. So that needs to be confirmed. And if we have to switch over from pyrethroid alone to PBO-net or some other synergist net, and no second generation LLIN, the decision has to be taken based on that.
2.5 minutes left, Dr. Kalpana.
Yeah, just I have, I'm coming then. So challenge for vector control, reaching outreach, we are having very hardcore areas. You can see with the both these LLIs were taken to the periphery. And from there it is distributed in the campaign mode to the community. And you can see the locality, how the community, they are coming and they are collecting their needs. COVID-19 pandemic, it is really, it has, the entire globe has come to stand still, we can say, and India has also faced a lot. All these implementation of vector control interventions were challenged. LLI distribution, though we procured, it could not reach to the periphery on time. Then again, distribution. Then IRS was challenged. Surveillance, as I said, there's parasitological surveillance, then entomological surveillance, then monitoring, all were challenged. Category 1 states, those states, the target was 2020. We missed the opportunity. We don't know. Currently also, we are having the second wave of COVID and how long it will continue. But even then, our fight continues against COVID. You can see those people, they are masked up, there's, all the people, and they are working in the field. And WHO has also appreciated, if you see the best story in Southeast Asia website on malaria and COVID, you can see it is there. I especially wanted to share this slide. The forest guard, he is checking the LLIN with the community. The LLIN provided to them, really they are having it, they are using it or not. And these type of areas are there in our country, and to reaching all those areas with LLIN or other, there's vector control tools and intervention is really a challenge. This is what I have mentioned. Now you see the map, shrinking malaria endemicity map of India. Just I'm sharing since 2014 till 2020, you can see how the map is shrinking and shrinking. And eliminating the spots in the last map, the existing hardcore areas with a huge gap of entomological HR is a major challenge for the program. Thank you very much for your patience. Thank you.
No, Dr. Kalpana, our patience is because the presentation was so interesting. So there was just rapt silence, everybody listening very raptly. So Dr. Kalpana, genuinely interesting, thorough presentation with so much detail and information. Sincere thank you for that very insightful presentation, and congratulations to India for the impressive, I mean, you showed that shrinking of the map of endemicity. So I think the whole world admires India for the amazing efforts it has made and the success it has achieved in reducing the malaria burden. Unfortunately, we don't have time left, Dr. Kalpana. I can assure you, everybody enjoyed the presentation, benefited from it. You can see from the Q&A box and the chat box, there's lots of interest and response, but unfortunately, we have to move on to the next presentation. But maybe you can go to the Q&A box and see if you can privately respond to some of those questions. Sincere thanks, Dr. Kalpana.
It's my pleasure.
Thank you for that.
I'll do that. I'll go to the QA box. If it is there, then
It's there. No, it's there. Absolutely.
I'll be happy to do that. Thank you.
Thank you, Dr. Kalpana. Much appreciated. So we're going to move on to unfortunately, I mean, this is absolutely so enjoyable and fascinating. Could go on for quite a while yet, but it's our last presentation for the day by Dr. Didik Budianto from Indonesia. Presentation on vectors and vector control in Indonesia, current practice and challenges. Dr. Budianto is the Director of Vector and Zoonotic Disease Prevention and Control in the Ministry of Health in Indonesia. Before taking up this current role, he was also director of the Data and Information Center in the Ministry of Health, which is critically important for these qualifications and experience to bring it to malaria control. So Dr. Budianto, thank you so much for setting aside time, making yourself available to give us some insight and understanding of how Indonesia is conducting its vector control strategies and activities. So over to you, Dr. Budianto.
Okay, thank you, Chair. But sorry, I cannot start my video. Okay.
So
Okay.
you're having
Okay,
troubles bringing your presentation on screen?
It start, yeah. Okay, thank you. Thank you, Chair, for the opportunity, and good afternoon, all of colleagues and participants. I'm happy to share our malaria vector control practice and challenge, and happy to learn also from all. Next, I think.
Dr. Budianto, I'm not sure. Would you like us to call on screen your presentation, or are you going to do it? Would you like us to call it up on screen?
Maybe can the panitia help me to share screen?
Yeah, sure. So Tin or someone, are you able to call up that presentation, perhaps?
Yes. Okay, Dr. Helen, and my colleagues, Dr. Helen, or maybe the panitia. Yeah.
Yes, Dr. Didi. So Leo, the screen will share from yours.
Okay, so you're asking APMEN to call it up on screen. So
Yes,
just give us,
APMEN,
thank you, Dr. Helen. Thank you, Dr. Budianto. Just give us a minute. We'll do our best to call it up.
Okay.
Hi, Wulan, do you have the presentation ready with you?
Sorry, I've just called it up on my screen here.
Okay. I think it's now showing. Thank you.
Dr. Budianto, can you see it on screen?
Not yet.
Tin, am I not sharing screen?
No, you're not.
Oh my goodness. Maybe you can just hop over here if you don't mind.
Give me 1 minute.
Okay. I thought I was sharing screen.
Okay. Can you speak us?
Is that on screen now?
Not yet, Dr. Leo.
It is on screen? Okay.
Under your picture. Not yet. Okay, that is all. Yeah. Okay. Thank you very much, Dr. Leo.
Good. You just tell me when to change slides, please.
Yes. Okay. The next, yeah. Yes. Next slide. Yes. This is our presentation. We have 4 parts of which malaria and malaria vector situation, and our practice vector control, our challenge, and the future agenda. Okay. The next. Yes. This is our malaria and malaria vector situation. Yeah, next. Ladies and gentlemen, this is our latest malaria situation in 2020, our malaria map is continuously shrinking. Only 24 districts remain high endemic, mostly in the eastern part of the country. This district contribute to 90% of malaria cases in the country. Last year, we recorded 215,000 malaria cases countrywide. The other 172 districts are moderate and low endemic with about 58 districts reporting problem with outdoor transmission among forest workers and indigenous population. Yeah. Okay, next. We have 26 anomalous species confirmed as malaria vector, with vector in Papua identified as Parauti, Flavoriostris, Coliensi, and Punctualtus. I mentioned particular this area because in the other part of country, LLIN mass campaign reduced dramatically malaria cases, like in Sumatra, Kalimantan, Sulawesi, and Maluku Island. But our experience is different in the Papua. Yes, next. In our 24 remaining high endemic districts, a number of districts have API of higher than 100 per thousand population. In this area, a rapid etymological survey conducted by a research group in Indonesia revealed that breeding sites are abundant within the residential area. Next. Other studies showed that malaria vector in this high endemic district are active from evening to morning, with outdoor and indoor beating occur at similar proportion. A study also observed the community habit, including in if they spend the evening and night inside or outside the house. And we are starting using LLIN. Only a proportion of the community are actually protected by LLIN. And while they are outside, they do not practice personal protection, such as using tropical repellent or using long sleeves. Next. In the low endemic district, we have those that hasn't moved from low endemic to malaria free in the last 5 years. This our current challenge, especially as we don't have enough evidence at the moment on the malaria transmission and its factor in the setting. The next, please, thank you. How is our current practice of vector control? Yes, next. We have stratified our malaria elimination strategy based on the stratification of malaria endemicity in the district. We have 4 stratification. In high endemic district, the strategies is acceleration. Here to vector control include universal coverage of LLINs. We protect the whole population of the district with 1 LLIN for every sleeping space, including sleeping space outside the house. IRS for villages with API more than 20 per thousand population. Larva control, SPCC, activity, and vector surveillance. For those with a moderate endemicity, the strategy is intensification. Here to the vector control, including LLIN for high endemic village, which may distribute through focal campaign, IRS, if there is increased cases, larva control, SPCC, activity and vector surveillance. For those with low identity, endemicity, the strategy is elimination. Here, the vector control is emphasized on receptivity, mapping, and tailored intervention based on result of epidemiological investigation. We also encourage personal protection, and we do vector surveillance. For those which have been certified malaria-free, the strategy is maintenance, with activity include vector surveillance, larva control, and personal protection. Yeah. Next. We conducted mass LLIN campaign every 3 years. Last year, despite COVID-19 pandemic situation, we distribute 2.8 million LLINs to targeted district among 2.4 million target to be distributed. For province, haven't achieved the distribution target due to COVID-19 restriction. For those provinces, the distribution is still ongoing. Yeah. Next. This is how the LLIN campaign is conducted to avoid crowd. We do not use distribution point. Instead, our village malaria cadres distribute the LLINs door to door. Yes, next. Nationally, around 30 million insecticide pet net were distributed since 2004 through routine distribution and mass campaign. The LLIN mass campaign, as you all see in the slide, was initially conducted by region or island, which successfully reduced endemicity in that island except for Sumba and Papua Island. In the last 2 campaigns, we conducted country-wide mass and focal campaign. In 2020, out of target of 3.4 million LLINs and a total of 8 million LLIN have been distributed in 100 districts or cities and 16 provinces in Indonesia, with the remaining still ongoing. Next. Being laid out in the equatorial line, we have abundant Annapolis breeding site. Since the Dutch era, we have practiced environment management for larva control, including environment modification, which is permanent removal or prevention of larva habitat, and environment manipulation, which is the temporary removal or disturbance of larva habitat. The efforts include detailed activities, which you could all see here in the list. Yeah, next. Ladies and gentlemen, one of our successful experience has been a participatory learning and action, or PLA, for community-based vector control, in which we conducted PLA session in village with abundant breeding site to trigger community action. We have been very successful in one province with initially a high endemic province, no and low endemic, with 2 out of its 10 districts have no certified malaria-free, while the other 5 have recorded 0 indigenous cases in the last 2 years. The PLA have successfully transformed the landscape of the district, but not only that, it also increased awareness on malaria as shown by increased blood examination rate by 8 times after a PLA. This activities is now being scaled up using Global Fund support in the 2,000 villages in high endemic district by our community partner. Next. We campaign the vector control activity with social and behavior change communication to encourage communities in using LLINs and practicing personal protection against mosquito bites, but also to encourage community lead source reduction. We involve community leaders and school in high endemic district for the SBS CC. Yeah. Next. Ladies and gentlemen, we have just developed a vector surveillance system inside the malaria information system and the integrated vector surveillance. Reporting is conducted by head center level for village-based vector information. Reporting compliance haven't been high as it was only established in the last 2 years. But we have seen this very promising to enable us monitor the vector situation more systematically. We will continue to support the district increase the reporting compliance. Yeah, next. As you have seen throughout my presentation, we face 4 major challenges in malaria vector control in Indonesia. And the first one, vector control shall be adjusted to local situation. However, number of trained entomologists is very limited at the local level, at center level, I mean, to lead local vector control strategy. And the second one, LLIN campaign only will not be sufficient for dramatic reduction of malaria in high endemic district, considering mosquito and community behavior. Other intervention need to be considered. And the third, outdoor transmission among MMPS, minor, larger indigenous population, remain a challenge. And the fourth, vector information or data for evidence-based intervention in lacking, while vector surveillance initiative has only been started, it still needs strong effort for implementation. Next. And to respond to the challenge mentioned in the previous slide, we would like to one, develop a strategy to put in place entomologists at minimum in district level. And the second, mobilize community-driven vector control in high endemic district. And the third, tapping to regional knowledge, maybe good APMEN facilities on MPS and other transmission control. And the fourth, strengthen integrated vector surveillance system. I think that is my presentation. Thank you very much. And back to Dr. Dr. Leo, sorry. Thank you very much.
Dr. Budianto, sincere thank you for that presentation. Very insightful. And yes, of course, APMEN would love to help to the extent it can. So we'll be in contact. I do want to ask that please, I'll make this plea again and again, both Indonesia and India and all our country partners, please participate in the discussion sessions on Wednesday and on Monday, where we will be introducing new tools and asking for for your identification of areas where APMEN can help if you feel you need help in any way. So please, do try hard to send malaria control, National Malaria Control Program representatives to the discussions on Wednesday and Monday. So again, thank you, Dr. Budianto. I had my screen.
Thank you.
Thank you for that. Yeah. Please try hard, Dr. Budianto. We'd like to see you on Wednesday. So I had my screen full of the presentation. I wasn't following the Q&A box. No open questions, it says. No, nothing in the chat box either. Okay, so it's interesting. There's time for one question, and I don't see any questions from anyone else. So both Dr. Kalpana and Dr. Budianto made the observation and commented on the lack of entomological staff, that there's inadequate staffing. So I'd like to ask, but this will hopefully come out during the Wednesday discussions as well. Even among the available staff, are those people sufficiently well trained, and can they do the job that they are appointed to do? So that's a different question. I mean, you can appoint somebody into an entomologist's post, but is that person able to do the job that they are appointed to do? And those are some of the things that we hope to unravel specifically on Wednesday. We've kind of run out of our available time for today, and I'm going to give a quick wrap up, at least my interpretation of how the presentations went. Let me just quickly check here in the chat box. No, it doesn't seem like there are any questions for the speakers in the chat box either. So Professor Burkott gave us an overview of survey results on capacity strengths and limitations for malaria vector surveillance, which suggests that there is a widespread need for capacity strengthening and training for improved vector surveillance, and that substantial investments are needed for increasing the number and capacity of programmatic staff. And he also described the content and the structure of a potential new survey to assess vector surveillance capacity in the Asia Pacific region later this year. And I made the commitment that we will try our level best to enable James Cook University to undertake that vector surveillance capacity shortfall or capacity status survey later this year. Then a great presentation by Dr. Stefan Karl, who spoke to us on quality control of LLINs. And he pointed out that in Papua New Guinea, around 1.3 million LLINs are distributed each year, and yet malaria case numbers are increasing. And then he reflected on worrisome findings that show that all LLINs prior to 2013 achieved WHO cone bioefficacy criteria, but only 17% of nets delivered after 2013 achieved cone bioassay criteria. Procurement needs to shift from price-focused procurement to a system that rewards quality and cost effectiveness. Then Dr. Kalpana, you gave us a great presentation on vector control in India, showing the strategies for vector control and surveillance. You picked up on the issue of intersectoral collaboration, which I was very happy to see somebody mention that aspect. You showed the impressive reduction or the objectives of eliminating malaria by 2022 in an additional 26 states, full elimination by 2030. You showed 21% case reduction compared to 2019 to 2018, and then even more impressive reduction in case numbers between 2020 and 2019. You're also interesting to all other countries in the region, most other countries, the use of larvivorous fish for presumably mainly Anopheles stevensii. And I pick up on that point because stevensii has, as you're all aware, been exported from Asia to our colleagues in Africa, the Horn of Africa. And there's a need to support our African colleagues with the decades of experience that, especially in India, our colleagues in India have so much experience that they can share to try and address the increasing and expanding problems presented by Anopheles stevensii by spreading across wide areas or potential spread from the existing core areas of distribution in the Horn of Africa. Then Dr. Budianto gave an overview of vector control in Indonesia, insights regarding challenges which include the following: the number of trained entomologists at local level, they're very limited, which creates problems implementing effective local vector control strategy. The LLIN campaign by itself will not be sufficient for strong enough reduction of malaria in the high transmission endemic districts, and that supplementary interventions need to be incorporated. Outdoor transmission amongst mobile malaria people remains a challenge. And finally, vector data for evidence-based intervention is not adequate, and vector surveillance needs strengthening and support. So, ladies and gentlemen, sincere thank you for participating. Dr. Rose, I'm not sure if you have anything you might want to add in closing to our audience, please, Dr. Rose.
Yeah, thank you, Dr. Leo, for your summary review on the presentation today. I think today we have covered many topics, including surveillance and also capacity strengthening of what we have, especially in the vector surveillance, and also looking at the quality control of LLIN, and also looking at the progress that the country has have achieved, especially for India and Indonesia. I would like to congratulate for India team and also Indonesia team. They worked very hard, and I think we can see the result was very positive for them to achieve the eliminations according to their targets. So I can see that there are room for improvements, especially in the vector control. I think what we can observe, especially for the surveillance systems, we can maybe improve in some areas. For example, GIS mapping for especially the vector control activity, and also for vector mapping for the country, so that this can strengthening their methods of prevention and controlling malaria in their respective country. And I think we have after this we have more topic will be discussed, especially on the 12th, on the 17th, right, Dr. Leo? And also on the 19th, yeah?
Correct. We'll have more presentations introducing new tools for vector surveillance, both on Wednesday, this Wednesday, day after tomorrow, and then again on Monday. And then following Wednesday, there'll be the session will be devoted to involvement of private sector. So there's more, the focus will be on vector surveillance day after tomorrow, and on Monday again,
Yeah,
especially introducing new tools. Yeah.
Okay, one more thing that I would like to express. I think I would like to congratulate to India and Indonesia also, because I can see that they are implementing integrated vector management. So actually, APMEN and APALMA have been supporting this country to attend the integrated vector management that is conducted in Malaysia since 2011. So I think they already apply what they have learned to their country, and it give a good result for them. I think congratulates to both of this country.
Thank you for that summary, Dr. Rose. Always warm words of appreciation from you. Some good guidance and appreciation. Thank you for that. There was a question from one of our audience members. Just a quick question. Will the same Zoom link work for the 12th and the other days? My understanding is yes. You can use exactly the same link to access our conference Wednesday and following Monday and next Wednesday as well. So colleagues, Jenyan, sincere thank you and enjoy the rest of the day. Go well. Thank you.
Yeah. Okay. Bye.
Bye-bye now.
Yeah.